President Obama signed the bill, some things went into effect that very day. Dependent coverage was available to all dependent children or non-dependent children until they were 26. So you could have a child who was married, had his or her own job, and you could keep that child on your individual or group insurance plan until they were 26 years old, unless they had coverage available through their group plan, if they had one. But that was made available immediately. No lifetime maximums anymore on any insurance policies. So the $1 million, the $2 million lifetime, whatever you had on your old policy is gone. Pre-existing conditions were for all children on group and individual policies. Guaranteed issue plans for children, individual plans, up until age 19 came about. Preventive care services became fully covered, no limitation. And we've all seen all the plans that were issued before this time, where you might have had an annual limit, especially on individual policies, that might have been anywhere from $100 to $200 to $500. That's gone too. As long as it's age appropriate and AMA guidelines, you've got full coverage here. Small business tax credits came into play, and any business that was under 25 employees and had certain salary ranges for those employees was eligible for a tax credit. And what we've heard through IRS reports and things like that is about 5% of all the businesses in the United States actually did receive a tax credit. So not a big deal there. And emergency services, any emergency medical service that you'd incur, regardless of where it was, in-network, out-of-network, hospital, or doctor's office, had to be paid in-network now, because it wasn't your choice to have a broken arm or whatever, so they changed that. In 2012, we had a few other things going on. A lot of them were kind of procedural. I saw Tim, Jim, you guys in here, a lot of it had to do with the way the doctor's offices had to manage their practices. And how insurance companies had to do appeals and minimum loss ratios. Some very things like the women's preventive services came into play in August, and that enhanced the preventive care for women dramatically. They had some fees that they started to implement for patient-centered outcome. This thing, summary of benefits, coverage, and uniform glossary. The federal government decided to get involved in putting a summary together of those 80 or 90-page policies, and they came up with a regulation that said you have to condense that into 8 pages. They told you what font you could use, as that font was, and Colorado had already done that. And Colorado had a really good plan description. The federal government's plan description leaves a lot to be desired. It's really hard to read, hard to understand, but that's part of every single plan that's out there now. This year, we have some other things. I like this one. When the government's involved in administrative simplification, it is mentioned. I haven't seen that yet. And I don't know if any of you doctors have seen it either, but that's in there. An annual fee on medical device sales. So there's a tax on that helps cover the cost of the bill. Some other things, flexible spending account contributions have been limited to $2,500. They were at $5,000, so if any of you are offered that, that's been cut in half. High earner taxes begin, patient-centered outcome fee increases to $2 this year, and the W-2 reporting starts. Going forward in 2014, some of the major issues. Health benefit exchanges kick in. Colorado's is going to kick in October 1st, and that'll be open enrollment for a January 1 effective date. It'll apply to both businesses and individuals. Businesses under 50 employees. So an individual starting in October can come to us, say they want to go through the exchange, and get their coverage ready to go on January 1st. Guaranteed issue and renewability for virtually every type of plan that's out there. No pre-existing conditions. No annual dollar limits for anything. Now we've got away from the annual maximum, or the lifetime maximum. Now they're going to get away from any kind of annual maximum benefit. Waiting periods for groups, 90 days. That's the maximum waiting period you can give an employee now, starting next year in January. Deductible caps cannot exceed $2,000 for an individual and $4,000 for a family. Small group fully insured plans. So if any of you have a $3,000 deductible, that won't be allowed anymore. You've got to knock it down to $2,000. Essential health benefits are required for small employers, and out-of-pocket limits have to comply with the same out-of-pocket limits for health savings account plans. The other stuff is in your handout. It's a lot of verbiage, and we don't have to cover everything. So what happens in 2014? We're going to have expanded benefits. We'll have wages, taxes, fees, reporting requirements. And as a result, we're going to see the fees, taxes, and benefit requirements and ratings that will have an effect on the cost of healthcare for employers and individuals over the next several years. So you can see that here's your premium in the middle, and we've got a lot of different things that are putting pressure on that premium.